Hi, my name is Jason Resendez with UsAgainstAlzheimers, and I lead our health equity and access work. I'm excited to share more about our efforts to drive brain health equity for communities that have been traditionally underserved by the Alzheimer's research, enterprise, and healthcare system. First, a little bit about UsAgainstAlzheimers. We were founded in 2010 as a social impact organization and patient advocacy organization focused on driving 4 priority areas: health equity and access, brain health and early intervention, the voice of the Alzheimer's patient and caregiver, and speeding treatments. Our vision around health equity is really rooted in an urgent need to drive health, economic, and racial justice and access to Alzheimer's health research, health services, and care. We know that this is the right thing to do, but also we believe that it can lead to better science, better health, and better care. We advance this vision through a 3-pronged strategy rooted in community data. We think data at the community level is really critical to helping us identify and understand where disparities are manifesting and the factors that might be contributing to those disparities. Second, partnerships and resources. We know we can't do this alone. We need to partner with community-based organizations, with interdisciplinary researchers and practitioners in the healthcare field, and in other areas. And we also know, third, that advocacy and policy is essential to move the needle on the deeply entrenched inequities that we face when it comes to addressing the Alzheimer's challenge. So today I'll focus on our database work and the National Alzheimer's Disease Index platform that we've launched, and also our public health work through the Center for Brain Health Equity, which is supported by the Centers for Disease Control and Prevention. On the community data side, we've launched with the National Minority Quality Forum, a platform called the National Alzheimer's Disease Index, or the NADEX, which takes Medicare and Medicaid data and allows us to analyze that data by geography and by subgroups, looking at Alzheimer's health statistics. So we're able to analyze Medicare data on Alzheimer's and related dementias by different demographics and by different subgroups, do cross-tab analysis within the platform to visualize where disparities are manifesting. We've used this to understand, again, where there are high impacts of Alzheimer's in the Medicare program among populations of interest. This is a map of the counties most impacted by Alzheimer's among the Black community and among the Latino community. We partnered with the Urban Institute to analyze this data, to understand geography, but also to understand what are the impacts of Alzheimer's in these communities in relation to other social determinant factors. So we pulled in data from NHANES, from the Robert Wood County health rankings, to understand what are the similarities between these highly impacted counties and also counties that are the least impacted by Alzheimer's among these counties. And what we found was when we analyze these social determinant factors, we find that counties that are the most impacted by Alzheimer's among Blacks and Latinos face deep social inequities. So these counties had higher percentages of families living in poverty, lower median household incomes, lower levels of health insurance, and fewer opportunities to access exercise. And so while we're not saying that these social determinant factors cause Alzheimer's, we know that they're critical to helping us form a fuller picture of how Alzheimer's and related dementias are impacting communities in low resource regions. We think that information is vital to informing the development of interventions, of educational strategies, and certainly in developing policy to help support communities with a high burden of Alzheimer's. We also took this approach to understand Alzheimer's research infrastructure. Partnering with the NIA, we identified all of the federally funded Alzheimer's research sites in the country. Those are now integrated into our platform so we can visualize and overlay on top of the Medicare data Alzheimer's research sites. And so what we found in our initial analysis was that there are big gaps when it comes to research infrastructure in communities that are highly impacted by Alzheimer's, particularly in communities of color. What we found, for example, in South Texas, until recently, there was not a single Alzheimer's Disease Research Center actually in the entire state of Texas, despite the high impact. In fact, of the 25 counties most impacted by Alzheimer's among Latinos, 10 of them were located in southern Texas. Thankfully, recently there was an announcement of the newest ADRC being established in South Texas, a collaboration between the University of Texas Health Sciences San Antonio and the University of Texas Rio Grande Valley, which is a critical way of investing in this area that has been underserved by Alzheimer's research. But we also see gaps in other areas like Southern Florida, which is highly impacted by Alzheimer's among the Latino community, yet there's very limited research infrastructure in Southern Florida. Second, I want to talk about our public health work. We launched, with support from the CDC, the Us Against Alzheimer's Center for Brain Health Equity to really focus on driving collaboration to develop and disseminate brain health, culturally tailored brain health education. We have a focus on 3 areas. One, educating and mobilizing minority-serving providers, particularly Black and Latina nurses, in partnership with the National Black Nurses Association and the National Association of Hispanic Nurses. And we think it's vital to partner with nurses because these health professionals are on the front lines of so many of the health inequities that our communities face. Yet we know through literature review, we know through focus groups with these providers that they are not equipped and have not been empowered with the culturally tailored education that they need to adequately respond to the growing impact of dementia in their communities. And so our goal is to be able to build capacity among these professional societies, but also among their membership to be brain health ambassadors in communities. And we're doing that by a focus on our second area, which is the development of culturally tailored brain health messages and educational resources, which there's a lot of great resources out there. In fact, NIA, as we all know, is developing an amazing suite of resources through Outreach Pro and Adore. But these resources are not necessarily making it into the hands of communities, and they're not always tailored for providers, for example, or community-based organizations. And so we have a focus on making sure that those resources are tailored to these audiences and are accessible to those audiences digitally and through other avenues as well. And then our third focus is in taking data like the NADEX data and empowering community partners and policymakers to better understand how brain health inequities are manifesting, where they're manifesting, and how to translate that data into action through public policy and public health programming. This is an example of some of the resources that we've developed this year through the Center for Brain Health Equity, taking behavioral risk factor surveillance data, BRFIS data, on subjective cognitive decline and packaging that for our subgroups of interest. So you see 2 infographics here, one focused on the Latino community, one focused on the Black community, really putting into context information on subjective cognitive decline with information about the need to talk to providers if you're noticing extreme memory loss. We've also developed similar resources for providers. We have a provider leadership group that's made up of a diverse set of interdisciplinary clinicians working to develop easy to understand and utilize education around risk reduction and brain health. Our focus is in making sure that this kind of information reaches and is tailored to our provider partners, the NBNA and NON and other providers of color who are serving underserved communities. We've also launched a platform called Brain Guide, which is an online platform, a first of its kind tool to help families and individuals navigate brain health education. It includes a series of online and phone questionnaires that someone can take to better understand whether or not they're having memory health issues, to understand what that might mean, and then to provide them with resources tailored to their responses to those questionnaires around things like risk reduction, around general education. This is something that's available in English and in Spanish, and it also links to the local area agencies on aging network of resources. So it's while it's a nationally organized and available, it is also has a component that is localized when it comes to resource sharing and access. So when we think about how you can work with us in advancing your brain health equity goals, one, we'd love to continue to bring new partners and help us develop the NADEX platform. That could mean bringing your expertise as a data scientist, If you have ideas around research and research questions that you think the NADIC could help answer, we'd love to collaborate with you on that. Second, as we develop culturally tailored public health communications, we're always looking for expertise around health communications and bringing that expertise into the brain health space. But also when it comes to disseminating resources that we're developing, always looking to partner with folks to do that. And then lastly, certainly sharing resources. So Brain Guide is a great example where we have a rich set of tools to help you talk and get Brain Guide out into communities, again, available in English and Spanish. We've been so excited to partner with many of the folks within ADRCs doing this work to help develop this platform, and would love to continue to collaborate with folks in the network to get this into the hands of communities that could benefit from this tailored education. So thank you for your time and for your work to advance brain health equity in your communities and your research centers.